this video, I'm going to talk about risks come with pregnancy. Every woman prepared to conceive and carrying her baby, or maybe already got pregnant, need to learn about them, to avoid them and to eliminate them as much as possible and minimize their risks if it happened they occur to her during pregnancy, for the best management for feminine health during pregnancy and postpartum period. So they don't come surprisingly and you don't know how to deal with them, dear lovely mama. My name is Hana Hakami. I have a master's degree in physiology and developmental biology, and I am a PhD in cell biology. I have no degree in gynecology, and I'm talking in these episodes totally based on my experience as a mother of two adorable children and as a scientist who goes and researches a lot of information and get them from reliable resources. This episode is an extension of a previous episode in which I covered 6 problems commonly occur during pregnancy, and I classified them hierarchically from my point of view as basic problems built on each other. So we covered in that part obesity, gestational diabetes, fatigue, preeclampsia and eclampsia, diastasis recti and herniation, as well as hyperpigmentation. In this episode today, I'm going to talk about more problems occurs during pregnancy and postpartum period. So, today we are going to talk about varicose and spider veins, water retentions or what is called edema, asthma and allergies, the weaknesses of bones and teeth, pelvic floor muscles and pelvic bones and joints related problems. So let's start with the first problem. It is about varicose and spider veins. Varicose veins are enlarged, twisted veins that may occur in any part of your body, but commonly they happen in the lower part of your body, including your legs, either face or bottom, and around your belly, near your hip area. Varicose veins are caused by increasing the blood volume and pressure in the vein with poor circulation, especially in the lower part of the body, leading to a frequent accumulation in the veins, and after a while the vein wall start dilating, enlarging and twisting in the area, usually near the skin surface. Varicose veins usually are not considered serious condition, but they are associated with frequently feeling sore in the area around them, inflammations and swelling, as well as heaviness in the legs especially, and feeling burning in the body parts where we have varicose veins. Plus the emotional impact on the patient with varicose veins by feeling embarrassed and not comfortable with their varicose veins looking on their skin and the skin discoloring around them. It is important to know that a severe varicose vein condition may lead to a serious health condition if it's not maintained and developed worse and worse on the long term, including more serious skin conditions as well as ulcers. During pregnancy, the blood volume increased to support the pregnant woman, the baby, and the placenta that provide the baby with enough nutrients. So the occurrence of varicose veins and spider veins is highly increased during pregnancy, and there are factors may increase the blood pressure and worsen having varicose veins, including genetic factors, being overweight and obese, being a pregnant woman under all that hormonal changes, being inactive, smoking and taking drugs, as well as being over 30 years old. So it is very important to support your circulatory system during pregnancy to avoid having circulatory related problems, including varicose and spider veins. So it is highly recommended, especially for pregnant women, from the beginning, before even having any varicose vein issue, or even if you have it before being pregnant, to support your body by elevating your legs, is to elevate your feet above the level of your heart, which recommended to be in sitting condition or with being tilted, like sitting tilted and elevating, so the foot becomes above the heart level for 3 to 4 times, 15 minutes every time. And this is very good idea to also have massage, like to massage your legs up toward the heart to help the circulatory system to push the blood back to the heart, so there is no accumulative blood in the veins, especially in the lower parts of your body. Also, being active to walk at least 30 minutes a day during pregnancy, it will help so much to overcome and eliminate varicose veins development. And as I mentioned in the previous part, avoid obesity as much as possible. Avoid being overweight as much as possible before getting pregnant and during pregnancy. If it happened that you are overweight or obese during pregnancy, try to keep your body weight in control and consult your dietitian and your gynecologist to see what is the best to have a healthy pregnancy, avoiding as much as possible problems may occur to your health during pregnancy. And one important thing happen to multiple women, and unfortunately when they give birth, especially in the pandemic conditions where there is a limited contact between people, including the doctor who examine you after giving birth, they may forget to examine if you have developed any varicose veins. They may forget to ask about how is the sensation in your legs and how do you feel, to examine if there is any blood clot may happen after giving birth due to the high blood pressure due to giving birth process. So you need to make sure that you ask your doctor to examine if your doctor did not do by himself or by herself after giving birth. Now we are going to talk about the second problem. It is about water retention, or what's called edema, that may happen in any part of your body or overall your body. Commonly in pregnancy, the swallowing of ankle and foot happen so frequent to several women. It developed worst and happen more by approaching the 3rd trimester, but there are women experiencing edema even when they are not pregnant, and when they get pregnant it becomes worse. It is normal to get some swelling during pregnancy in your legs, ankle, feet, fingers and toes, and even the wedding band doesn't fit your finger anymore, so it's okay, you can remove it during pregnancy, you don't have to fit it. But my point here that when you observe that, this is a sign of not having a good blood circulation and the lymphatic system circulation in your body. So again, you need to massage, you need to exercise, you need to be in a good control of your body weight and weight gain, you need to lift your foot up, you need to drink enough water, and you have a good meal plan, meaning that you eat in a good way with nutritious food. If the swelling happened gradually, you shouldn't be very much concerned about it during pregnancy, but you need to know that you need to drink enough water, release yourself from stress. But if it's happened sudden swelling that associated with preeclampsia and eclampsia, a problem I mentioned in the previous part, which is a very serious health condition during pregnancy, you need to take care of it right away. And you need to be monitored as soon as possible with your gynecologist, family doctor, the health practitioner you are following your pregnancy with. One thing you may notice when you have swollen different parts of your body or all over your body, it may happen when you wake up in the morning, or maybe at the end of the day when you keep working, standing, moving, and you are very tired and you noticed it at the end of the day. You need to know that you need to massage your body frequently in the morning once, especially if you wake up with a very swollen eyes, which happened to me with foot. Also, it happened to me on both pregnancy, but the second pregnancy it was less because in my first pregnancy I had actually preeclampsia. So you may notice that whenever your body starts swelling, you are feeling kind of lost, tired, having a headache. You may even start feeling dizzy. That may impair the clarity of your vision. So you may start seeing flashlight, the views can become blurry. These signs need that most likely you have a high blood pressure, you are perhaps preeclampsia, and if you start feeling a severe pain and you may start a serious vomiting and dehydration issue, you need to go to the emergency right away, because these may are due to the serious health condition preeclampsia, which threaten your life and your baby life if it's not monitored and treated properly. Now we come back to the normal pregnancy swelling or the normal pregnancy water retention. It's happened because your body actually want to keep more water, but because you are pregnant and the growing baby is pushed more because your bladder is under the baby pressure, the baby weight, the same thing for urethra. So you need to go to the washroom frequently, then your body is trying to have some water. So remember, if you want to have a healthy pregnancy, including even the non-serious like normal pregnancy body swelling, you need to be fully hydrated, eating healthy, being active reasonably, and as much as possible relax and far from stress. What can you do to avoid this swelling? So you need to avoid sitting, standing for a long time. Wear comfortable socks and shoes. Don't wear tight clothes. Drink plenty of water. Eat healthy and make sure that you take your prenatal that support your body and supplemented with the needed vitamins, fatty acids and minerals. Exercise if possible daily, at least 20 to 30 minutes walk a day. Lift your legs up and massage it for 3 to 4 times a day, 15 minutes each time. Now we are going to talk about the third problem that may face you during pregnancy. It's about developing asthma and allergies. Honestly, most of the scientific research have shown that the severity of the asthma and allergies during pregnancy is more associated with the pre-existed condition of asthma and allergies before pregnancies. But still, a lot of pregnant women develop asthma or develop a severer form of asthma and allergies that they may not be recognized before pregnancy during pregnancy. Me, myself, I developed a lot of skin rash. I became more sensitive on the allergies for the food. I already have some degree of allergies against certain type of foods. It became worse during pregnancy. So you need to observe yourself, find what may irritate your body or irritate your skin or that cause an allergy when you eat it or drink it. So find what is your comfort zone and avoid anything that may cause allergy to you or worsen, cause a severer level or type of your allergies. And when we are talking about asthmas and allergies, being under stress, being obese or overweight, as well as having unhealthy lifestyle, enhance the allergies, increase the severity of having asthma and allergy. Now we are going to talk about problem number 4, which is about the weaknesses of bones and teeth. You may not feel it right away. By the first pregnancy, maybe you give birth, maybe after 2 or 3 years, even after give birth, you start noticing that. When I'm going to talk about bones and tooth, you need to know that your body, whenever you start getting pregnant and you don't have sufficient minerals supplement to provide the formation of the skeletal system in your baby, then your body start giving from your own to your baby, because the body mechanism happen to protect the baby and to provide this little growing thing inside you to have a better healthy life. So if you don't have solid, strong bone and tooth, and you don't have enough supplement during pregnancy from your diet to support your baby growth, that will give the signal to your bone and tooth to release the calcium, the phosphor, the vitamin D, all the important minerals to grow a skeletal system in your baby, to go out of your bones to supplement your baby. So you end up with being very weak, not only in your bones, in your joints, in your tooth, in your chondroids. You start feeling weak, you cannot carry things like before, and you start having pains, especially around your pelvis, back, shoulders, because your body mechanism to support your baby may take from your strength to give your baby life. So you want to have a strong body enough to support yourself and to support your baby. You may not feel it during pregnancy, or maybe if you feel it after giving birth, you forget about it because you are busy, or maybe you even breastfeed, and that will consume even more from the strength of your bones and tooth. So what you need to do, you need to make sure that you take enough supplement, you eat food rich in materials help to support a healthy bone, joints, tendons, and anything related to the skeletal and the musculoskeletal system. How can I say that? Musculoskeletal system. Yes, I love that. Everything to support your musculoskeletal system, including your bones, tooth, cartilage, ligaments, tendons, and muscles. Also, during pregnancy, a lot of women suffer from having cavity, or the cavity is worsened during pregnancy. So you need to make sure that you brush more frequent during pregnancy every day than before you used to do during pregnancy. You may need to brush up to 5 times a day. The things also that may worsen your tooth during pregnancy, the upset stomach, the acidic stomach condition increase, and the acidity may travel from your throat back to your mouth, and that affect also the surface of your tooth and worsen the health of your tooth. So you need to check actually during pregnancy and postpartum and breastfeeding period more frequently. So I would suggest every 4 months, if it's not every 6 months, with your dentist. For your bones, you need to make sure that you are active, because the more you're active, the more your bones can build stronger and maintain a better health. Plus, you take enough supplement, either if you want to take it as a pill or what you eat from your food option, to support your bones and teeth health. I would like to talk here about something. Usually people, when they are talking about the weaknesses of bones, they talk a lot about osteoporosis. I'm not going to talk now a lot about osteoporosis, which I think most of the women in this world now, they know what is it, in which it is a disease condition to a point the bones break easily and cause a significant weakness in your skeletal system. I would like to talk about something is not highlighted, but is a serious issue for women who get pregnant and give birth after years. They start losing their hearing sense. It's called otosclerosis. Otosclerosis, it's happened for several reasons, but one of the causes of otosclerosis that lead to deafness perhaps, or to a significant hearing loss in women in earlier age than men, and even some of them in the middle of 20s or 30 years old, due to pregnancy and unwell maintained bone condition. When your bones start getting weak and majorly affected, the first bones that get affected in your skeletal system, they are the very, very small bones, which the smallest bones in your body, they are in your internal ear. And when the smallest bone in your body become fragile, they may start not moving enough and vibrating enough, and they even may stop moving, and that lead to not transferring the vibration to signal to your brain, so you don't hear, and you lose your hearing gradually, or maybe even suddenly during pregnancy, or after you give birth, or a few years after you give birth, because you neglected your bone health, and your bones, they started getting weaker and weaker. So if you want to keep your bones in a good health condition and don't want to lose your hearing sensing, make sure that you maintain a healthy diet to support your bones, being active enough, drink milk or any milk alternatives to help your body. Take vitamin D supplements, take the prenatal and postnatal supplements to support your bone health. The fifth problem and the last problem I would like to talk about it today, it's about the pelvic floor muscle and bone health related conditions. It's a very big topic. I'm going to put a video talking in details about these problems, but I would like to pay the attention to the importance of supporting a good pelvic floor muscle health and bones. The first time I heard about pelvic floor muscles, I did not know what does it mean, pelvic floor muscles exactly, because I have never studied medicine or physiotherapy or learned every single muscle name and location in my body. And I thought it's only about the muscles that they are directly attached to our pelvic bone and maybe around our pubic bones and legs. But it ended up that it is also about the muscle that support to hold up our colon, rectum, uterus, your ovary, your bladder, your urethra, all these muscles, small tiny muscles in between. And when you get pregnant, the baby in your uterus get bigger and bigger and bigger. So the heaviness of the baby, it's pushed on the muscles for a long time. Like, imagine how many weeks you are carrying the baby inside you, and that pressure applied on these muscles, so they are extended and in very high tension for long period. If you don't support your pelvic health in a way that you carry your baby in a healthy way without being overweight, with having a belly support over your body or over your abdomen or baby belly. If you don't try to lay down as frequent as possible, every hour or every 2 hours if it's possible, lift your foot up, and also ask your husband to help you to carry the baby and for a few seconds every day. It will release a lot of pressure on your muscle that they are tension, then they can relax a little bit, and will help the support and the health of your pelvic floor muscles and bones. There are issues, usually they are developed more significantly postpartum, but they actually start during pregnancy, or they maybe even pre-exist before pregnancy, including cystocele, that you cannot hold your pee well, rectocele, that you find difficult time to get your poops out. I'm sorry, I'm gonna say it. You find very hard time to use the toilet to poop. First, when I was a little bit young, kind of child, that when somebody say constipation, it's like that you have that big dry caca or poop, I'm sorry, that doesn't go out of your body, but it's ended up now constipation, that even if you have very soft poop but cannot release from your rectum easily. So the process to release and to discharge your feces out of your body, it is difficult. The gases itself, if you want to fart, you find it very difficult to control your fart, the same as you have a hard time to control your pee. And there is the separation between your pubic bone joints, which is called diastasis, symphysis, pubis, as well as the pain in the tandem that hold your pubic bone and joint together, which is called symphysis pubis dysfunction, which they are associated with a serious pain in your hip, backbones almost every day. Sometimes it's very painful even to walk, to do any basic activities. So if you want to support this area of your body, which is very important, an essential area of your body and health, we needed to sit, to stand, to walk, to move around, to do so many things, to carry your baby itself. So you need to maintain a very good health for your pelvic floor. So wear a belly support from day one, from the beginning, based on the size of your belly. Wear a band, rest as much as possible to release the pressure on your pelvic floor muscles and bones. Maintain a healthy body weight as much as possible during pregnancy and postpartum. Consult your gynecologist, physiotherapist, and maybe you need some massage therapy that's specific for your health condition, either during pregnancy or postpartum. We came to the end of this episode. It was actually challenging to put all these problems together, because usually people, they talk in only one video about one health condition where you don't know even this health condition, what is it, so you don't know how to search it. I'm trying to put a general topic about the problems or risks that happen during pregnancy, that anyone wants to understand what's exactly the risks that may happen to them or what they are experiencing, and they search for it. When they are watching this video, they can distinguish which problems happen to them and what is really the name of it, so they can search in detail deeper and deeper. I hope the video helped to spread the awareness between women who are already pregnant or trying to conceive or planning for conceiving. I wish the best to every woman to have the best feminine healthy life in all their aspects, mentally, emotionally, and physically. If you like this episode, give it thumbs up, share it with friends and family, subscribe to my channel, write in the comment section what is your opinion about this episode and what you would like to hear in the coming episodes. Thank you for watching. Take care and goodbye. See you soon.